Hi, this is Alysha Schertz, reporter for BizTimes Milwaukee. UnitedHealth recently partnered with Cisco to launch Connected Care, a national telehealth network designed to expand physicians' reach into underserved areas. I'm here with Jeff Knoll and Dr. Bruce Weiss from UnitedHealth here to talk about Connected Care. So guys, tell me a little bit about what Connected Care is and a little bit about this mobile clinic that's behind you guys.
Well, this is the office visit of the 21st century. And what it does is it combines UnitedHealth's network of physicians across the country, which is the largest one that any insurance company has, with cutting-edge technology from Cisco. And putting those together, we're able to bring extra access to areas that you normally wouldn't see certain specialties of physicians.
Tell me a little bit about the technology on board. I know you guys have a lot of technology to reach rural areas and those kind of things. What kind of technology is on board for patients to come?
Well, it's the same technology that they use for the space shuttle communication. So it's primarily a satellite communication, but it's very high def. So when a physician is talking to a patient, it's almost like you're sitting right there.
What is the process? I know people are going to be able to come to this mobile clinic. Are they sitting there with the doctor, or where is the doctor coming from?
Well, that's the beauty of the technology. The physician could be in Milwaukee, and the patient could be in rural America where there's a huge shortage of specialists, and it's almost as if they're sitting together, and they can carry on a conversation. There's a big screen, people are very comfortable with it, and it's like having an office visit, but there's a screen there instead of a live person.
I think one of the biggest questions people are going to have, with the problems with some sort of technology reaching some rural areas, is this going to work in rural areas, or how is the technology going to force that to work?
Well, the way the system's set up, it can either go off of a satellite, which we have currently working here with the mobile trailer, or it can also just use simple broadband internet communication. So even in the rural community, if there isn't access to broadband, then a satellite hookup would allow an isolated facility to be able to stay in communication with medical specialists anywhere in the country.
This is obviously some cutting-edge technology. Where do you guys see this going in the future as far as a mobile clinic and those kind of things?
Well, I think this mobile clinic is really a great test bed for the technology. It allows the clinic to go anywhere. It's completely self-contained. But in reality, I think all of the technology that's in there can easily be moved to almost any environment, an employer office site, a rural health center, and be able to give access to specialty care and specialists anywhere in the country. So the technology right now is available so that we can provide good quality care by specialists, and really the location doesn't matter. Anywhere that has an internet hookup or electricity basically can be set up as one of these clinics.
Yeah, one of the exciting things from my perspective is down the road being able to do this in somebody's home. So people who are disabled or confined to a house are able to get the specialty care they need, whereas they might not otherwise be able to get to it.
Where the actual physician visit would occur, so the patient sits here in the chair, and I would be a nurse or some other licensed provider that would be facilitating the visit with the physician who shows up here. They see the same equipment that we do, so on that screen they're going to see the patient, and then they also have this screen where our vital information, where we take blood pressure and so forth, that populates the screen, as well as the image or data from any of our instruments that hook into the system. They all show up here. For example, this is a general exam camera, and if I were to zoom in on Andrew's hand, I can take a picture of it, and that image is sent over, and the physician on the other side can see that, and we have capabilities to do ultrasound, EKG, stethoscope, ear, nose, and throat, essentially any equipment that can collect and transmit data digitally, we can hook into the system.
And we do that via the satellite on the front of the truck. So Keelan's actually in Minneapolis right now, but as long as that provider is, on the network, we can connect into any node, if you will, on the network.